In this video, we are going to start our discussion on infections in pregnancy. So, especially today, we are going to discuss about different infections, like different microorganisms which are causing problem during pregnancy. So, mainly, let us discuss about these three in this video. That is a cytomegalovirus, rubella, Toxoplasma Gondii. About the other organisms, we'll discuss in another video, like about other infections. So, mainly in this video, we are going to cover cytomegalovirus, rubella, Toxoplasma Gondii. So what is a causative agent for cytomegalovirus? Actually, cytomegalovirus is a DNA virus. Okay, whereas rubella R for R, it's an RNA virus. Whereas Toxoplasma Gondii, it is actually coming from protozoa, like it's a intracellular obligate protozoan parasite. Okay, so it is a protozoan parasite. So coming to its definitive host, cat is a definitive host here. This is very important to remember regarding this. So CMV is a DNA virus, rubella is an RNA virus, Toxoplasma gondii is intracellular obligate protozoan parasite, definitive host is cat. Now coming to the history. This cytomegalovirus, here the mother is in close relation, here the pregnant female is in close relation with infants, while working in infant school or something related to infants daycare, like that. Whereas coming to rubella, there is no history, like they will not say any history. Whereas history in Toxoplasma gondii is having a cat as pet, meeting the cat feces, like contact with cat feces, or eating raw or uncooked meat. So these are the causes history of Toxoplasma gondii. Now coming to maternal infection. In the case of cytomegalovirus, the maternal infection is mostly asymptomatic. And even if you see in Toxoplasma gondii, it will be mostly asymptomatic. Okay. And of course, even in the rubella, it is asymptomatic, but it is only 25 to 50% asymptomatic. Here it is 80 to 90% asymptomatic. Even here it is 80 to 90% asymptomatic. But in rubella it is only 25 to 50% asymptomatic. Okay. So now coming to the close, 10 to 18% cases of cytomegalovirus. 10 to 18% cases of cytomegalovirus, you will see there is lymph adenopathy, because you can see a in the name you can remember like this, cytomegalo, like everything is become mega. So lymph adenopathy, pharyngitis, and you'll have flu like symptoms and also fever. So this is seen mainly in cytomegalovirus. Coming to rubella, you are seeing a mild febrile illness. Along with that, you will have maculopapular rash. So this is very important here, maculopapular rash. And 25 to 50% female are asymptomatic, already discussed. Now coming to Toxoplasma gondii, here the symptoms are like, here they have fever, they also have rash, and they also have lymph adenopathy. So it's a mixture of all three. Okay, so also having lymph adenopathy. So now coming to most common transmission, that the most common time of transmission, that is from the mother to the fetus. The vertical transmission time in the case of cytomegalovirus is third trimester. So in third trimester, from the mother to the fetus, the cytomegalovirus may pass. Even the Toxoplasma gondii also may pass from the mother to the fetus in the third trimester. Whereas coming to rubella, it will pass in the first trimester itself, that is like maximum first 12 weeks. In the first 12 weeks of pregnancy only, this rubella virus can pass into the fetus. Now coming to most severe infection time in the mother, when is the most severe infection time? Okay, so most severe infection time is first 2 months. First 2 months of pregnancy is the most severe time for cytomegalovirus. Whereas coming to rubella, first 12 weeks, as we are already saying, in the first 12 weeks only there is also vertical transmission. In the first 12 weeks only there is also most severe infection. That is, that most severe infection is called as congenital rubella syndrome. This congenital rubella syndrome occurs only in 16 to 20 weeks of pregnancy. So congenital rubella syndrome occurs in 16 to 20 weeks of pregnancy. So it will start from the first 12 weeks, and this congenital, especially congenital rubella syndrome, is from 16 to 20 weeks of pregnancy. And after 20 weeks you will see there is sensory neural hear loss. So there will be sensory neural hear loss after 20 weeks. So in rubella you need to remember this time lags. First 12 weeks there is most common time of vertical transmission from the mother to fetus, and again first 12 weeks it starts, severe infection time starts. Congenital rubella syndrome occurs between 16 to 20 weeks, and after 20 weeks you will have this hearing loss problem. And coming to this Toxoplasma gondii, here also first trimester is the time where there is more severe infection. So now coming to important points like most common congenital infection is seen in cytomegalovirus, and in rubella there is most severe congenital infection we already discussed, that is between 16 to 20 weeks. Okay, whereas there is no any congenital disease in the case of Toxoplasma gondii. Okay, now coming to fetus. In fetus there is mental retardation in all of three. Okay, either if you take cytomegalovirus, either you take rubella, either you take Toxoplasma gondii, in three of these diseases you will have in the fetus. In fetus you will have mental retardation, okay, and you will have learning disability, growth restriction in three of them. Now coming to intracranial calcification. Coming to intracranial calcification, here in the case of cytomegalovirus there is intracranial calcification around periventricular space. Around periventricular space there is intracranial calcification. Okay, and that is also having microcephaly. There is also microcephaly here. Next coming to rubella, there is nothing like that. Whereas coming to Toxoplasma gondii, here you have intracerebral calcification and hydrocephalus. So very important this point. Intracranial calcification is around periventricular space leading to microcephaly in CMV. In Toxoplasma gondii there is intracerebral calcification leading to hydrocephalus. Now coming to the eyes. If you see the eyes of CMV, the eyes look like chorioretinitis. They have chorioretinitis in the eyes of cytomegalovirus. In the case of rubella there is cataract and glaucoma. Cataract and glaucoma are seen in rubella, whereas there is chorioretinitis, and there is triad of Toxoplasma, that is 1 plus 2 plus 3. 1 plus 2 plus 3 means just add intracerebral calcifications, hydrocephalus with chorioretinitis. These are called triad of Toxoplasma, and also you can add convolutions to it. So these are all mainly seen in the Toxoplasma gondii infection. Now coming to the ears. Already we discussed in the ears of cytomegalovirus there will be SNLH, that is sensory neural hearing loss, which is the main cause during childhood. This main cause during childhood. And next coming to heart diseases. Heart diseases are seen only in rubella. So whenever there is heart problem, then in infection that will lead to seen mainly in rubella. There is also pulmonary PDA. There is also PDA, pulmonary stenosis. There is pulmonary stenosis and PDA. Whereas coming to Toxoplasma gondii, you will never see any of this kind. Now let us discuss some additional features which are related to cytomegalovirus, rubella and Toxoplasma gondii. So first one, in cytomegalovirus you will see anemia. So because of anemia there is also increase in bilirubin levels, and also there is hepatosplenomegaly. Increased bilirubin, anemia in cytomegalovirus. Coming to the rubella, there is neonatal purpura. You can see neonatal purpura in rubella, and here also you will see hepatosplenomegaly, and there is radiolucent bone disease. There is radiolucent bone disease, and the diagnosis is cataract plus congenital heart disease plus sensory neuronal hair loss. All these are seen in rubella. Now coming to Toxoplasma gondii, there is congenital toxoplasmosis, which is suspected when USG ultrasound reveals hydrocephalus plus intracerebral calcification, and you will see ascites, placenta thickening, hyperechoic bowel, and IUG or intrauterine growth restriction. So in all these cases you will see Toxoplasma gondii. So this is the thing which we need to see in the additional features. So by this we have completed the differentiation between the cytomegalovirus, rubella, and also Toxoplasma. Okay, so next we'll start with diagnosis of infections and management of rubella and Toxoplasma, and also parvovirus B19 infection in next video.